I acknowledge and welcome the participation of the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, who will give the keynote address. My fellow members of the board of the Heart Foundation, members of the press, and others, welcome. Today's event serves a dual purpose. Firstly, February is Heart Month. In February of every year, organizations and individuals concerned with heart health and involved in heart health worldwide recognize, celebrate, and acknowledge this month as Heart Month. It is a global event, much like COVID-19, but in a good way. This becomes a time when we particularly focus on a heart-related theme and invite the rest of the community to do so as well, and to think of their heart health and hopefully do something about it. This year we say, check your heart, be COVID smart. We would usually have an increased frequency of public service advertisements and educational fora. It is also in Heart Month that we produce our annual medical symposium, which will this year be held on February 26 virtually. Secondly, we are excited to be celebrating our 50th anniversary as an entity in 2021. The Heart Foundation of Jamaica was founded in 1971. This is indeed a milestone. Our Vice Chairman, Mr. Winston Barrett, was just reminding us at our last board meeting that many companies do not last for even half that time. And we know that this did not happen by chance or good luck, but by hard work and commitment to our purpose. Today's event serves as the launch of both Heart Month and also the year of celebration of our 50th anniversary. Having said that, the past year has been difficult. The arrival of the SARS-CoV-2 and the subsequent COVID-19 illness has brought dark days with the loss of several hundred of our citizens and the sickening of thousands more. We are particularly concerned at the Foundation because we know that the deleterious effects of the COVID-19 pandemic are superimposed on and inextricably linked with the other pandemic with which we in this region and many million others struggle worldwide. And that is a pandemic of chronic non-communicable diseases, NCDs. These include cardiovascular diseases, which are diseases of the heart and blood vessels, hypertension, stroke, diabetes, chronic lung diseases, cancer. As it turns out, these conditions, as well as obesity, increase persons' risks of being seriously ill or dying from COVID-19. We explore this relationship and the risks in our medical symposium later in February, the theme of which is COVID-19, an affair of the heart. But today we welcome you to the launch of the Heart Month and the 50th anniversary celebrations of the Foundation. I will now take you through a walk through 50 years with the Foundation, and then the Minister will address us. Thank you and welcome. Although we cannot encapsulate all 50 years of the activity of the Foundation in a few short minutes, we do want to point out some of the highlights and some of the interesting times that we've had at the Foundation. These are just a few milestones. The Heart Foundation of Jamaica was founded in 1971 by the Lions Club of Kingston. And here we have a picture showing, in the Gleaner, showing Lion Bernard Cridland and Sir Philip Sherlock at the Sheraton Kingston Hotel at the launch of the Heart Foundation of Jamaica. Why was the foundation founded? Well, cardiologists who were members of the Lions Club of Kingston expressed concern about the situation regarding heart disease in Jamaica at the time. In those days, rheumatic heart disease was a predominant type of heart disease because this is related to poor socioeconomic conditions, to infections in the throat, and we were having large amounts of children coming down with rheumatic fever who then went on to become adults with rheumatic valvular disease, and they needed surgery in order to treat their valve disease. A committee was formed to establish a heart foundation, the purpose of which was to do fundraising activities which would support the efforts of the public hospitals who were involved in heart surgery, to raise funds, therefore, to get the supplies to help patients to have valve surgery. That was the purpose of the foundation at the outset. One of the premier fundraising events was a Heart Health Fund Run, which was started in 1978. It was usually held in November of every year, and we would get people to sign up and to pay money, and they would go around the stadium and raise money for the Heart Foundation. Here we have a picture of a patient, and on the bottom we have Dr. Donald Christian, who was one of our more prominent cardiologist, and he's examining a patient. Dr. Christian was also very closely linked with the Heart Foundation and its efforts. Peter Bangato, who was one of our long-standing chairmen and who has now passed on, is seen in this picture with staff prior to their first assignment using a mobile clinic. So we decided that some patients could come to us at the foundation, but we could get to a lot more people if we could go out to them. So a bus was purchased, and the staff would pile into the bus and go out to health centers and to different communities so that we could screen patients in their own environment and make it simpler for them to have access to screening. And this first bus was donated by the Azilda Lions Club of Canada under the auspices of the Canadian International Development Agency, CIDA. In 1984, another milestone was achieved when we launched a CPR program, cardiopulmonary resuscitation. This was done under the chairmanship of Dr. Edward Chung, one of our prominent cardiologists, and assisted by Sister Sherry Lopez, who was a registered nurse and a nursing sister at the University Hospital of the West Indies. In 1991, we moved premises from Ellesmere Road, where we were basically just cotching, to a building at 30 Beechwood Avenue, which was jointly purchased by the Heart Foundation of Jamaica and the Lions Club of Kingston, with proceeds from the Honda for Heart raffle held in 1986. This was chaired by our own current vice chairman, Winston Barrett. Every year we used to have these Honda for Heart raffles. I entered every year as a teenager and never won anything. The Vic Higgs Memorial Golf Tournament was started in 1993. Vic Higgs was a Lion. He was a member of the Heart Foundation on the Heart Foundation board, and he was also a patient who had had heart disease, and so knew from all angles what it meant to deal with the Heart Foundation. And Vic Higgs was killed in an untimely manner, and this golf tournament was launched in his memory, and this is held annually, and is very successful. Our pharmacy was established in 1994. At the pharmacy, which is operated in association with the NHF, patients can come and get medications at discounted prices. And if you're a member of the Heart Foundation, you get an even further discount. So this is a service that is used by the patients and appreciated. In 1995, the school's health education program was started, and these continue today. They're called Healthy Heart Clubs, and they operate in a variety of schools where we teach children about heart health, about healthy eating, about exercise, and educate them from the time that they're very young so that when they become adults, they will appreciate it and continue in this way. But things were changing in Jamaica, and we realized that the health status of the population was changing. There was a marked decline now in rheumatic heart disease, which you remember was prominent at the time when the foundation was started. Instead, we were seeing the emergence of ischemic heart disease. That is a type of heart disease in which you get blockages in the blood vessels of the heart, heart attacks, angina, and this is associated with obesity, hypertension, diabetes, and high cholesterol, and other risk factors which are driven by unhealthy lifestyles, like tobacco smoking, poor diets, physical inactivity, and excessive alcohol consumption. So these are really lifestyle diseases. But we noticed that the population was changing. This is just another picture of a handover of a mobile unit by the Friends of the Heart Foundation of Jamaica, UK. We have a very active branch in the UK, which are the Friends of the Heart Foundation of Jamaica. They're always involved and always seeking to donate and help us. Here in 1996, you see the Minister of Health at the time, Honorable Peter Phillips, and George Bullock, who was the chair of the Heart Foundation at the time, viewing the mobile unit along with a member of the Friends of the Heart Foundation UK. This is a picture of the waiting room in the original building, quite a small space, patients waiting patiently to be seen and registered. In 2003, we started advanced cardiac life support training. This is a form of CPR, but this was under the auspices of the American Heart Association, and today we remain an AHA certified center for teaching and training in cardiac life support. Here is a picture of the visit of the president of the AHA at the time. This is him in the middle, Professor Gus Grant, who is actually a Jamaican and is well known to colleagues locally, along with several prominent doctors, Professor Denbo on the left, Dr. Christian on the right, beside him Dr. Knox Hagley, and Dr. Mohammed in the middle, along with two representatives of medical drug company. In 2008, after a fundraising effort, Heroes of the Heart, we were able to buy the building next door at 28 Beechwood Avenue and open our new building, which is where the foundation is housed today. That was in 2008. This is now the Peter Bangata building where we do all our operations. In the 2000s, the Heart Foundation of Jamaica turned its attention to that of influencing policy, because we realized that no matter how much we educated patients about treating their conditions, about screening, about exercise, about food choices, it would be very difficult if they remain in an environment that is not conducive to making healthy choices. And the environment in which we are and were is not conducive to that. So the only way to change the environment is to influence policy and bring about changes on a national level. So these efforts started with tobacco smoking, and they saw the establishment of smoke-free environments and graphic health warnings on cigarette packages. The Jamaica Coalition for Tobacco Control, of which the Heart Foundation of Jamaica is a founding member, and the Secretariat lobbied the government for tobacco control legislation, and this has recently been tabled in Parliament. Here is a picture showing the launch of the JCTC, which was done on World No Tobacco Day, which was May 31, 2002. And another image of some of the members involved in the JCTC in the early years. Where are we today in 2021? Well, our vision is for Jamaicans to have a longer and better quality of life through the prevention and control of cardiovascular disease. Our mission statement is to promote a healthy lifestyle leading to the prevention of cardiovascular disease through advocacy, health education and health promotion, and by offering accessible and affordable screening and treatment in a professional and welcoming environment. Because our goal is to reduce morbidity and mortality from cardiovascular disease in Jamaica by promoting cardiovascular health through screening, treatment, education, research and advocacy, and by aligning around the WHO-related target of a 25% reduction in premature cardiovascular disease mortality by 2025. Healthy nutrition is a focus of our most recent advocacy work with the successful Are You Drinking Yourself Sick campaign and the restriction of sugary sweetened beverages in schools. And in January of 2021, there was a further reduction in the level of sugar which is allowed in beverages, and that has taken effect. You remember our campaign with Rosie, who was drinking the 52 teaspoons of sugar every day. Advocacy continues its efforts to have front of package labels on all food products, because we believe that if people know what there is in their food, then they will be able to make smart choices. We don't want labels at the back of the food where they're hidden away. We want big, bold labels at the front of packages so that people can be educated and make the right choices. Efforts to ban advertising of unhealthy food products to children, and advocacy for a tax on sugary drinks to reduce consumption of these and to provide funding for programs in obesity prevention in children, for example, by the provision of nutritious school meals. The Heart Foundation of Jamaica promotes heart health in Jamaica through screening, management and treatment services, health education and training, and health promotion and advocacy. Our services include a screening clinic where you can come and get your blood pressure checked, your blood sugar, get your weight, your BMI, your waist circumference. Mobile screening teams, which will go out to health centers, into communities. Supermarket and outreach screening programs. So you may have seen the ladies sitting at the desks in the supermarket. You can go up and get your blood pressure checked, your blood sugar, and so on. So even while you're going about your normal duties. Health fairs. We have a diabetes clinic, a cardiology clinic with cardiologists and advanced screening. Screening for athletes for sudden cardiac arrest. Hypertension clinic. We have nutritional counseling. We have advanced cardiac tests. We have a home visiting service. If you can't come out, if grandma is too weak, we can go to her, do her ECG, do her echocardiogram. And we have a psychological counseling for weight loss, depression, smoking cessation. These are some of our local and international partners, Ministry of Health and Wellness, the Lions Club, as well as a variety of overseas partners, the Inter-American Heart Foundation, World Heart Federation, the American Heart Association, the Framework Convention Alliance, the Healthy Caribbean Coalition, and the NCD Alliance, as well as many other local partners. Thank you. I'd now like to invite the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, to address us on this day. Dr. Tufton is a frequent partner with the Heart Foundation of Jamaica, and he's well versed on the issues. Dr. Tufton.
We come today together for two important launch events. The first is the 50th anniversary of the Heart Foundation of Jamaica, and the other is Heart Month 2021. Firstly, my congratulations to the Heart Foundation on the achievement of its golden anniversary. The team has my highest commendations on what has been a stellar half-century of contribution to public health in Jamaica, all the time demonstrating what great value there is in collaborating, perseverance, and of course consistency. From initiatives such as the Mend the Heart scheme to the rheumatic fever program, its nutritionist clinic, and all the others before and since, including the impactful mass media anti-obesity campaign cautioning Jamaicans about the dangers of sugary drinks. The Heart Foundation embodies what it means to be committed to a cause, and for me, there's no greater cause than public health. I must say that as Minister of Health and Wellness, I have worked very closely with the Heart Foundation for the past 5 years and have found the key operatives, the mission, the determination of this organization to be exemplary. And indeed, as part of public health, we have achieved a lot together. So I really want to personally, as Minister of Health and Wellness, commend those who have been involved and to celebrate with you on your 50th anniversary. I want to turn our attention to heart health, which has been a long-standing priority of the Ministry of Health and Wellness, and clearly with good reason. To begin with, Jamaica has a significant burden of non-communicable diseases, or NCDs, not the least of these cardiovascular disease, and in particular, hypertension. From 2001 to 2017, the prevalence of hypertension grew by some 50.7% among Jamaicans 15 to 74 years old. 1,520 people died from hypertension in Jamaica in 2016, for example, accounting for some 8.3% of all deaths. As a cause of death, it ranks 5th for men, 734 deaths, and 3rd for women, 786 deaths. Stroke, a major complication of hypertension, is the 2nd cause of death for both men and women. This is according to our Statistical Institute of Jamaica. 684,900, or 33.8% of Jamaicans 15 years and older, have hypertension. 31.7% of them men and 35.8% women. Only 32% of Jamaicans aged 15 years and older have a normal blood pressure, and a third, or just about 34%, are pre-hypertensive. 4 out of every 10 persons with hypertension were unaware that they had hypertension. 60% of men and 26% of women. On top of this stunning data, ladies and gentlemen, we also now have COVID-19, which puts people with NCDs at higher risk of death and severe illness with the disease. These NCDs, including cardiovascular disease such as hypertension, as well as persons who have had or are at risk for heart attacks or strokes. A look at the COVID-19 related deaths in Jamaica makes the point. Of the 339 deceased cases up to January 25th, 2021, some 198, or 58.4%, had a cardiovascular disease. The pandemic has also impaired access to routine care for hypertension and other cardiovascular and NCDs. The WHO conducted a rapid assessment involving 163 countries on the impact of the pandemic on NCD services. 77% of countries surveyed reported disruption in the NCD activities, while 3/4, or 75%, reported a disruption in NCD services. COVID has impacted, unfortunately, our capacity as public health to provide these critical NCD services. This is while a diagnosis of hypertension remains a main reason for visits to health centers. At the same time, the risk factors for hypertension continue to increase or remain below acceptable levels in Jamaica's 15 years and older. For example, high cholesterol affects 18% of Jamaicans 15 years and older, obesity 29%, overweight 25%, low physical activity 82%, tobacco use 14.8%, and harmful use of alcohol 8%. As a Ministry of Health and Wellness, we are prepared to do all that is within our power to ensure that NCDs, including cardiovascular disease, do not erode public health. This is the motivation for the recent launch of the Public Health Partnership for NCDs, in which 8 health centers and 4 private facilities in Clarendon, St. Anne and Kingston, and St. Andrew will provide treatment to approximately 5,000 hypertensive and or diabetic patients. The Ministry of Health has also seen to the establishment of chronic disease clinics in public health centers and the implementation of a chronic care passport as part of patient-centered management and clinician monitoring in primary healthcare centers. There is, too, the ongoing health system strengthening program for the prevention and care management of NCDs, which seeks to enhance the capacity of the public health system to deliver service to persons with chronic illnesses. With support from the IDB and the European Union, that program addresses infrastructure, improvements, and information systems for health to realize its intended outcomes. We also continue to pursue the ministry's wellness agenda, which has as its focus the promotion of personal responsibility in health, increased physical activity and healthy eating, as well as age-appropriate health checks for NCDs. This year's celebration of Heart Month, and under the theme Check Your Heart, Be COVID Smart, provides for us an important opportunity, and that is to remind ourselves of the value of our hearts and to prioritize its health and wellness. I look forward to the set of activities that will be in the coming weeks help us to do just that. Once again, I commend the Heart Foundation on its work and over the years, and wish for the team another 50 years of welcome contribution to public health in Jamaica. Again, congrats on your 50th anniversary. Thank you for the work that you have done. The Heart Foundation is a critical partner, a critical stakeholder in public health. And so we wish you many, many more years of hard work, of successes for the benefit of our population. Thank you very much.
As we're celebrating our 50th anniversary this year, we have devised a special logo to commemorate that. And you can see the regular Heart Foundation logo in the middle with the 50 years around it, and our gold swoosh to commemorate the 50th anniversary. Thank you, everyone. We're now going to ask Mrs. Nola Philpotts-Brown, who is our Marketing and Fund Development Manager at the Foundation, to raise the vote of thanks. Mrs. Philpotts-Brown.
I've been asked to move the vote of thanks on behalf of Mr. Winston Barrett, Vice Chairman of the Heart Foundation of Jamaica. If he were available, Mr. Barrett would say, I just want to start by saying a big wow. Wow, because we have truly come a far way here at the Heart Foundation. I stand here beaming with pride for the fruitful journey and for the opportunity to be part of the impact of the Foundation over the past 50 years. Of course, we did not get here on our own. We want to thank those who are joining us virtually on the various platforms today. We want to thank especially Minister Dr. Christopher Tufton. Minister Tufton, let me, on behalf of the Heart Foundation, thank you wholeheartedly for bringing such a profound message. Heartfelt thanks to you, sir, for highlighting the importance of prioritizing our health in trying times like these. Minister, we thank you for your continued strong support in all our endeavors over the years, and today for unveiling our 50th anniversary logo. To our other presenters, Dr. Andreen Chung, our board chairman, we thank you for ably providing us with a wonderful history about the work of the Heart Foundation over the years. I must express much gratitude to our executive director, Mrs. Deborah Chen, who, along with her effective management team, have been steering the Heart Foundation to be one of the most highly respected and recognized health institutions locally and in the international arena. Thanks to our members far and wide. Thank you for your support and loyalty over the last 50 years. Special acknowledgement must be made to the Lions Club of Kingston for walking alongside us over the years. Our Lions Club of Kingston are our founders. Thanks to our main sponsors of today's event, Blue Diamond Milk and Quaker Oats. Be sure to check out their delicious and heart-healthy products, which are available island-wide. Gratitude must also be extended to our other sponsors over the years and for this Heart Month. Today, we specially acknowledge the support of major sponsors, the National Health Fund, Lasco, Pascual Yogurt, and Bumblebee. There are those of our sponsors who have joined us virtually, and we thank you so much for your support and for your time. Finally, I could not conclude my remarks without mentioning our hardworking and dedicated staff who have journeyed with us and have been the frontline faces of this noble institution. Your support and interest in the work of the Heart Foundation has not gone unnoticed. We thank you wholeheartedly as we continue together to serve our beloved country, Jamaica. Thank you.
Thank you, everyone. That brings our program to an end. Thank you very much for coming. It's been a productive day. And remember, check your heart. Be COVID smart.